You do not notice the blood pressure first, you notice that something feels wrong. The bleeding may be obvious, or it may be happening inside your body where you cannot see it. At first, you are still awake, still talking, still trying to make sense of what happened. Then your heart begins beating faster. Your skin feels strangely cold. You become thirsty even though drinking water is the last thing on your mind. You stand up and the room tilts. For a moment, your vision darkens around the edges. Your ears may ring. You sit back down and tell yourself you are probably just shaken. But your body knows something you do not. The circulation keeping your brain alive is beginning to fail. So what actually happens when a person loses enough blood to die? And if consciousness remains long enough, what might those final minutes actually feel like? First, one important point: there is no universal countdown. A person can bleed slowly for hours or lose a catastrophic amount of blood in minutes. Age, medications, the bleeding site, and how quickly it is controlled all change the experience. But when blood loss becomes severe enough, the underlying problem is the same. Your body is losing its delivery system. Blood is not just red liquid filling your veins. It carries oxygen from your lungs to your brain, heart, muscles, kidneys, and every other tissue that depends on constant energy production. It also provides the volume your heart needs to maintain circulation. Lose enough blood, and both systems begin failing together. Doctors call the dangerous result hemorrhagic shock. It occurs when blood loss becomes severe enough that the circulation can no longer provide tissues with adequate oxygen and perfusion. At first, your body fights back remarkably well. Pressure sensors in major arteries notice that less blood is returning to the heart. Your sympathetic nervous system reacts almost immediately. Adrenaline and related stress hormones surge. Your heart beats faster and more forcefully. Blood vessels in your skin, digestive system, and less critical areas constrict. Your body is essentially closing unnecessary branches to keep the headquarters running. The headquarters are your heart and brain. This is why early blood loss can be deceptive. Blood pressure may remain surprisingly normal for a while because the body is compensating. You can be bleeding seriously and still be awake, answering questions, and insisting that you feel fine. Meanwhile, your pulse is accelerating. Your hands may become cool, your skin may look pale, you may feel anxious without knowing why. Your nervous system is being flooded with signals designed to keep you alive. Your body has detected falling circulation and switched into emergency mode. These compensatory responses, faster heart rate, vasoconstriction, and stress hormone activation, are central features of the body's response to hemorrhage. Then the losses continue. Less blood returns to the heart with each beat. That means the heart has less to pump forward. Cardiac output begins dropping. Your tissues extract more oxygen from whatever blood reaches them. For a while this works. Then it does not. Your muscles and organs begin receiving less oxygen than they need. Cells increasingly rely on less efficient anaerobic metabolism. Lactate and acid accumulate. Breathing becomes faster as the body tries to compensate for the metabolic disturbance. From your perspective, you may simply feel out of breath, but your lungs are not necessarily the problem. You can breathe perfectly good air and still feel desperately unwell because there is not enough circulating blood to deliver oxygen efficiently. This is where severe blood loss becomes strangely similar to suffocation. The oxygen exists. The transport system is collapsing. As shock deepens, weakness can become overwhelming. Standing may feel impossible. Your legs can seem heavy and unreliable. You may feel nauseated. Sweat can appear despite cold skin. Your mouth becomes dry, and thirst can become intense. Your heart is now racing because speed is one of the few tools it has left. Imagine a delivery company losing trucks and ordering the remaining drivers to move faster. That works only for so long. The brain is especially sensitive to falling blood flow. As cerebral circulation decreases, your mental experience begins changing. You may feel lightheaded. Your vision may narrow. Sounds may seem distant. Concentrating becomes difficult. You may repeatedly ask the same question or struggle to understand what people are saying. Some people become restless or agitated. Others become unusually quiet. There is no single emotional script. Movies love one particular version of blood loss. Someone lies peacefully on the ground, whispers a perfectly written final sentence, closes their eyes, and dies exactly when the soundtrack needs them to. Real shock is less cooperative. A severely bleeding person may be frightened, confused, restless, exhausted, or barely responsive. They may not understand how sick they are. They may try to stand even when their circulation cannot support it. and one of the most dangerous moments can look almost like relaxation. The frantic compensation begins to fail. There is a limit to how much circulation can be maintained when the tank itself is emptying. Eventually, blood pressure falls sharply. The heart receives less blood and less oxygen. The brain receives less blood. The kidneys drastically reduce filtration. The skin becomes cold and clammy because circulation is being redirected inward. Breathing may become rapid and shallow. Then thinking starts slipping. Clinical and laboratory studies of progressive central blood volume loss describe dizziness, disorientation, impaired responsiveness, and loss of peripheral vision as circulation approaches decompensation. Importantly, people vary substantially in how long they can compensate before deteriorating. This is the stage where the experience may become less like pain and more like fading control. You try to focus on a face, a voice, a light in the room. But attention keeps drifting. Keeping your eyes open takes effort. You may feel profoundly tired. You might experience a sensation similar to being about to faint, because physiologically, that is exactly what is approaching. The brain is no longer receiving enough blood flow to maintain normal consciousness. Researchers studying controlled reductions in central blood volume have documented symptoms such as dizziness, loss of peripheral vision, disorientation, and impaired responsiveness as people approach cardiovascular collapse. And here is something important. You do not need to have lost some magical percentage of blood for these symptoms to begin. Humans vary enormously in how well they compensate. One person may maintain blood pressure surprisingly well and then deteriorate rapidly. Another may show obvious signs much earlier. Medications such as beta blockers can even alter the dramatic racing pulse people expect. There is no safe DIY calculation. As the brain becomes increasingly underperfused, awareness can fragment. You may stop forming clear memories. You may not know where you are. Questions become harder to answer. Speech can weaken. The overwhelming alarm of the earlier stage may give way to confusion and drowsiness, not because the danger has passed, but because the brain itself is becoming unable to generate normal alertness. This is one reason someone who suddenly becomes quieter after major blood loss has not necessarily calmed down. They may be getting worse. Eventually, consciousness is lost. At that point, the person no longer has a reliable subjective experience we can describe. We can describe the physiology, but not scientifically narrate awareness after consciousness disappears. Inside the body, however, the crisis continues. Without enough perfusion, cells cannot maintain normal metabolism. Acidosis worsens. The heart becomes less effective. Severe trauma and hemorrhage can also disturb clotting and contribute to continuing physiological collapse. If bleeding continues, vital organs begin failing. The heart may enter a fatal rhythm or simply lose the ability to generate effective circulation. Cardiac arrest follows. But this is not how every severe hemorrhage ends. Hemorrhagic shock is an emergency, but it is not automatically a death sentence. If bleeding is controlled quickly and circulation is restored with emergency treatment, people can survive blood loss that would otherwise be fatal. The fundamental priorities are stopping the hemorrhage and restoring adequate circulation. And there is another reason this can be misleading. Visible blood loss is not the only danger. Bleeding into the chest, abdomen, pelvis, or tissues can be severe while very little blood is visible outside the body. That is why mechanism of injury and symptoms matter so much in emergency medicine. That is why the most dangerous mistake is waiting for someone to look like they are dying. They may not. Early on, compensation can hide the severity. A person may be talking while internally bleeding. They may even say they feel okay. Then the body's reserve runs out, and the decline can become brutally fast. So what do the last conscious minutes of catastrophic blood loss probably feel like? Not one clean sensation, more like a progression, a racing heart, cold skin, thirst, weakness, dizziness, a growing inability to stand, tunnel-like vision, difficulty concentrating, confusion, overwhelming fatigue. Then, if blood flow to the brain falls far enough, unconsciousness. Pain may come from whatever caused the bleeding, but the shock itself is largely the experience of a body desperately trying to preserve circulation while its circulating volume disappears. That is what makes blood loss so deceptive. You do not die because the body simply runs out of blood like a fuel tank hitting zero. You die because long before zero, circulation becomes insufficient to keep oxygen reaching the tissues that depend on it. Your heart can still beat, your lungs can still breathe, there can still be oxygen in the room, but the bridge connecting those systems to your brain and organs is collapsing, and your body knows it. It narrows blood vessels, accelerates the heart, sacrifices circulation to less essential tissues, makes you breathe faster, pushes stress hormones into your bloodstream. It fights with everything it has until compensation becomes mathematically impossible. That is the unsettling reality of dying from blood loss. The final enemy is not the sight of blood. It is disappearing circulation, and in the last conscious stage, the world may not suddenly switch off. It may simply become harder and harder to stay inside it. If you enjoy terrifying human biology explained through what the body is actually doing, like and subscribe.